Who is Valter Longo at USC, and what have you learned from him about health and nutrition?
Whoa, that's the man. Dr. Longo, a PhD, born, I know a lot about him, he's a colleague of mine, but he was born in Genoa, Italy, and spent half a year growing up in southern Italy, a region called Calabria. Why is that important? It's one of the regions where there's just exceptional longevity, and he watched many of his relatives live beyond age 100 with excellent health, without disease, traveling between northern Italy and southern Italy, but came to the United States as a young kid to actually be a rock star. He's quite a great guitarist, but got the bug about health, and got the bug watching his relatives in Chicago that were healthy in Italy become sick in Chicago from a change in diet, a change in lifestyle, a change in stress. And went over to Los Angeles to UCLA right when this strange project called the Biosphere 2, these scientists that locked themselves away for 2 years and ultimately demonstrated that calorie restriction, fasting, had big implications for health. He was a PhD student in that lab at UCLA with a guy named Roy Walford, started doing absolutely fundamental studies on what happens to the human body when we cut back calories, when we restrict. Actually started studying very primitive life forms like yeast. Ultimately moved to University of Southern California, where he now heads the Biogerontology Research Institute at the medical school, a very well-funded and prominent research institute. And to cut through the chase, he was fascinated by the issue of how do we age, how do we identify the biochemical pathways that create aging, what can we do practically to actually slow and maybe reverse aging. Whoa, that's like the whole deal, and he's basically done all that. He identified pathways at very basic biochemical levels in yeast and earthworms and mice, and now we know they're exactly the same in humans. There are some called mTOR, mechanistic targeted rapamycin. There's one called PKA-RAS, protein kinase RAS. There's other pathways using a hormone called insulin-like growth factor 1, of which Dr. Longo was fundamental in demonstrating their importance and showing that in an animal model, and now we know in humans, cutting back glucose and cutting back amino acids, that's protein, will slow those pathways that cause aging and promote healing, regeneration, and rejuvenation of the body, animal and human. Cut through the chase, a phenomenal book he published recently called The Longevity Diet lays out his 25 years of research and those around the world. He's created this human diet where 5 days in a row, maybe once a month, maybe once a quarter, maybe once every 6 months, you cut down to about 800 calories a day. You eat plant-based foods. That's when I learned about it a little over 2 years ago. I got excited. Real foods, whole foods, nuts, olives, soups, teas. You have it very low in sugar, glucose, very low in the amino acids. You actually stop the pathways that cause aging, allowing the body to heal itself over these 5 days, releasing stem cells from the bone marrow. There's no diet ever shown that can release stem cells from your bone marrow so the hip, the knee, the brain that needs repair gets repair. And then you go back to hopefully a very healthy diet at the end of 5 days. So it's not all that onerous. You're actually eating, but you get the benefits of fasting. That's called the fasting mimicking diet. It's actually a commercially available food product in a box, real food in a box, shipped out of doctors' offices. I've done that program myself over a dozen times. I've had hundreds of patients do it. And some of the benefit is weight loss, and it's fat loss, and it's visceral fat loss, it's abdominal fat loss. Some of it is decreased inflammation, blood pressure, cholesterol. It's one of the most effective ways I've found to get people on a plant diet is to give them a really good plant diet for 5 days. That's got the most medical science of any program I've ever seen to induce this magic word, autophagy, self-repair, to induce a little gentle ketosis. But it's 5 days of gentle ketosis. You go back out of ketosis when you start eating healthy again. So Dr. Longo is really incredibly popular for the right reason, because he's got a plan and a program that is practical, is usable. As long as you're free of a nut allergy, pretty much anybody other than maybe a type 1 diabetic or a really underweight individual can do. And the results are stunning. And what's going on in the research right now with breast cancer therapy, brain diseases, type 2 diabetes, these are ongoing projects using fasting mimicking diet by Dr. Longo in real clinical studies at the most prominent universities in the world. The next couple of years are going to be just amazing. So I'll just give one more example. If you do this 5-day box fasting mimicking diet and you, for some reason, need to have stem cells taken out of your bone marrow, as many orthopedic surgeons are doing now as part of an operation. If you do this program a week or two before that, you have a large amount of stem cells in your bone marrow you wouldn't normally have, and it's much more productive. So I've actually been able to work with some of the orthopedic surgeons in my city to introduce them to this concept that food can improve your results and the patients are benefiting. It's really just, as you can probably tell in my enthusiasm, probably the biggest breakthrough I've seen of simple strategy. It's not a drug, it's not a surgery, it's not a genetic manipulation, but the benefits are outstanding and scientifically supported.
The media often reports that alcohol in moderation is part of a healthy diet. What do you think about alcohol's impact on our health?
Yeah, alcohol is kind of a mixed bag because it's impossible to deny when you take the Harvard Physicians' Health Study, Nurses' Health Study, and other databases like that. You know, you got 100,000 people, you ask them questions, including, do you drink? Do you have one drink a week? Do you have one drink a day? Do you have 3 drinks a day? Whatever the questions are, and you look 20 years down the road, when you're looking at heart issues, over and over, moderate alcohol consumption shows up as a favorable habit towards preventing heart disease. This is after a process, it's called multivariate analysis, where things drop off the list, and usually eating a high fruit and vegetable diet, exercise, optimal body weight, not smoking, and why the heck is moderate alcohol consumption showing up on the list? And it does. It shows up in these large databases, and it causes one to pause, and do you recommend that to the public? Yet it's in the scientific literature, and usually specifically, it is the #1 killer of men and women, coronary heart disease. Now, when you look from a global perspective, there clearly is major problems with alcohol. We know that, and it leads to death, and it leads to liver disease, and it leads to accidents, it leads to societal problems. Do we recommend never drink? Well, we tried that in the 1920s. It didn't work all that well, and I don't think that's a recommendation you can make. The latest data is that alcohol is a toxin. It's a brain toxin. It's a body toxin. But like everything, dose is important. So a lot of the recent literature is maybe 5 drinks a week or less, if somebody's inclined to drink, is a reasonable spot to recommend without, being draconian about it. A couple days a week none, a couple, days or 5 days a week, 1 max. That's a shot of alcohol, 5 ounces of wine, 8 ounces of beer. It's not get the biggest wine glass in the world and fill it up. So there is a concern about breast health and brain health with alcohol, but keep it light, keep it infrequent, and I think it does fit into the joie de vivre, as they say, or the Mediterranean lifestyle, where it's very much a component of the complete Mediterranean diet. There's a couple maybe more advantageous alcoholic drinks than others, and they're usually red wine. In the island of Sardinia off of Italy, which is a blue zone longevity area with exceptional longevity, there's a grape that is called Kahn now, and you can walk in a wine store and buy a bottle for $15 of 100% Sardinian Kahn red wine, reported to have some special benefit. Some people say Pinot Noir. It's a difficult grape to grow, and it concentrates the active, they're called polyphenol ingredients. So Pinot Noir may have a little advantage. And these are sort of the reputation of the legendary wines of longevity.